Now I'd like to ask you and Dr. Friedrichs to join me for a panel discussion. So we'll keep this with us right now. Like to start with Dr. Friedrichs. I really like your approach of integrating participatory research and system science. I think it's very nice how you show the integration and how they can complement, those approaches can complement one another. A key component, of course, of this approach is community buy-in. And you presented two very different examples. One is in a clinical setting where you were dealing with clinicians, and the second in an educational setting. And can you talk a little bit about how you modify your approach to accommodate differences in the particular audience of focus?
Yeah, I think there's, three kind of recommendations I would provide around, how you might go about trying to tailor and adapt. And one is, it seems kind of simple, but always trying to kind of use your goals and your research questions as a guidepost to go back to. And those goals and research questions might shift and change over time, but if you kind of always go back to them, think about how the different activities are going to help you reach those goals and continue to kind of shape and adapt them. Two, something that I haven't always done in my work, but I have at least for one project, is to bring in some additional critical theories and frameworks as a lens to view your activities through. So I was really struck by Dr. Ford's earlier presentation around critical race theory. So bringing in those types of frameworks and viewing the activities you're doing can, I think, go a long way in helping you kind of bring to light how you might need to change and adapt them. And then third, probably most important is really trying to involve your stakeholders, your community, early on and in equitable ways in developing the actual activities, the processes that you use. So one kind of simple example, we had a high school student involved in our team early on as we were trying to kind of shape some of the activities for the young visionaries of health. And, this is just one example of how they really helped us. We wanted some sort of simple kind of exercise to help the youth kind of understand how kind of social cliques might form, but we wanted to do it in a fun way. The best example I could come up with was like the UNC versus Duke fans, which totally was going to fall flat with these students. But the youth we had involved was like, no, actually, we should talk about whether you're a Cardi B or a Nicki Minaj fan. So that was one kind of example. So those are three, kind of recommendations.
So how did you choose that particular youth? What was that process like?
So I have a community partner I mentioned the community enrichment organization. And so she's been vital, like sort of our community liaison of going into the school and talking to the principal and the counselors to really identify like who is that student who is going to be kind of, like going to be excited about this work, but also is not going to be sort of divisive in any way. So she's been critical to helping figure that out.
And I have one final question. Can you talk about some challenges you might have encountered in either or both of these examples you provided?
I think one of the challenges that I've encountered and I haven't completely overcome is really that tension and balance of kind of overcoming researcher influence. So I came into this project with, I already had sort of my own thoughts and my own kind of research questions in mind. And so it's really taken a lot of time and flexibility to really kind of bring the youth voice up through sort of my biases. And it's been really exciting over time to hear what they really want and see sort of, the questions they have. Like one of their key questions was, is physical activity a therapy? And so we really changed some of the questions that we were asking through our studies because of that.
Thank you. Okay, now we're going to turn it over to Dr. Katzman. I think your focus on education and the issue of obesity is extremely important. And I liked how you depict the links between education and health outcomes at the varying levels. I think that's very nice in terms of kind of helping us understand the influence that education has on health. Why do you think there's been such a lag in the uptake or integration of the system science methods, approaches to kind of untangle what's going on between education and health?
Thank you very much. I think it's both a supply side and a demand side issue. On the supply side, it simply requires the right people to be in a room talking to each other, knowing that these methods exist, knowing that these linkages exist, and knowing how to work together productively. Which sounds simple enough, I suppose, but it's much harder in practice. You need educational content experts, you need public health content experts, you need people who are well-versed in various forms of system science and knowing which research methods to apply and how to apply them, and how to work collaboratively. So all of these ingredients, all these pieces of the puzzle, are hard to get to fall into place. It's incredibly satisfying when they do, though. And on the demand side, I think as funders, as large research organizations, as publication venues, as policymakers become aware of the power and the potential of asking these questions and answering them with system science, there will be more interest. So it's something that simply is gaining steam over time. And the more that we can do to spotlight the examples of high quality linkages, system science linkages between education and health, the more appetite there will be for additional research in this area.
And along that line, where would you think it's important to start those kinds of interactions? At the actual level of the education or higher, looking at broader impacts of education, or perhaps at both? When you think about the categories that you presented earlier.
Yeah, I would say absolutely at both. Like I was saying in my final slide, I think both formal and informal means of beginning collaboration is incredibly important. So finding ways to get people who are involved, boots on the ground, educators and students interested in thinking in a systems perspectives, knowing that that's an opportunity, knowing that they can turn to system science research to start answering important questions can be really powerful. To give a concrete example, my doctoral dissertation looked at ways that school choice and student assignment policies in San Francisco could affect the levels of racial segregation in those schools. And that really came about because school administrators, district administrators, educators within that district were willing to work with me, were willing to believe that I could help them in meaningful ways. They came to me with good questions to ask. They came to me with open arms with data that I could use, trusting that I would use it in an appropriate way. So this is what I mean when I say all the pieces have to fall into place. And this is just a straightforward educational outcome. How much access is there by race to high quality education? What does segregation look like? If you were going to ask a question that had a public health aspect to it as well, such as, okay, well then what does it mean for there to be segregation within grade schools in a district in terms of obesity or access to sugar-sweetened beverages or physical activity, I would need more data. I would need more content expertise. I need buy-in from more people. And I'd need practitioners and intervention experts who would help me ask the right questions. And so it's really hard to get all those people in the room. And I think trying to do so through both formal and informal venues is incredibly important.
Thank you. Thank you both for your enlightening answers to my questions. I'm going to now open this session up for audience questions. As a reminder, please type your questions into the chat box and include the name of the speaker to whom you are directing the questions. We may not be able to get to everything because we only have a limited amount of time. Okay, we're ready. I'd like to, while we're waiting for a few audience questions to come in, I'd like the two of you to think about how you might, since Dr. Kasman, you're interested in education, and Dr. Friedrich, you had an educational example, how do you think you might work together and integrate your approaches? Either one of you can jump in.
Sure. So, I was really struck with the quality of work that you're doing, the participatory nature of it. I think that those can help elicit some very valuable research questions, some valuable insights that can then be used, kind of more in a larger scale, more formal way in a simulation model, for example, an agent-based model, which I know that you've engaged in yourself. And I think what can then be done is move from data and taken from a single setting and start asking questions that generalize. Say, what would work in different contexts? What about these contexts or these populations matters most in reducing health disparities, for example?
Yeah, and I would add that through the work that I've done and working with youth, there's definitely factors around education that have come into the discussion. So there's definitely links there that are important to consider. We just had a kind of a brainstorming session of where the group wants to go next, and there's a lot of discussion around the emotional stressors of school, but as also sort of like the future and what's next for them. So I think it's really relevant, and there's definitely links to be made.
Okay. There's a question for both of you here. Can either or both of you suggest some resources for engaging stakeholders in systems thinking methods?
So I think, there's a lot of different places to go to. I think group model building itself, I think, is great because there's kind of scripts out there, Scriptopedia, that you can draw on, a lot of literature that you can gain. I myself have also used the Creative Learning Exchange, which has a host of resources around engaging in sort of the education, K-12 education system with youth using these kind of methods.
Dr. Kasman, any thoughts about this?
Yeah, so I think one of the biggest resources are existing examples of really current high quality research. Kind of an emerging best practice in system science is around dissemination and using the results from system science research in ways that engage the audience. So kind of two ways to do this are with dynamic visualizations, for example. I provided in the college, in most recent college enrollment research that I've done, I put together a set of dynamic visualizations that anyone can use. They're on the Brookings website on the College Subsidies Report. And that's gotten policymakers, journalists interested. They can jump in and ask them, ask and answer the questions that are most relevant to them. Another example of this is the Tobacco Town modeling project, which I've also had the privilege of being involved in. That's created a really nice dashboard style visualization that can help communities answer questions about what policies might work in their specific contexts. So letting people know what the real potential and opportunity is around these things means moving beyond kind of stale forms of dissemination. I've seen, unfortunately, people come into conferences with community members with regression tables. And that's not really the way to bring people in and get them excited, enthusiastic about working with you and engaging in the work themselves. More clear, more dynamic visualization will get people thinking about how they themselves can engage in this research or work with researchers to ask and answer interesting questions.
Okay. There's a comment here that an important tension emerging here is the implied need for people to have a variety of skills, strong skills in mathematics, computation, and the like. And also, at the same time, strong skills in understanding people, including themselves. And these are classically siloed disciplines or skill sets. So what might be some of the unintended consequence of classic disciplinary boundaries, and how might we overcome them? How might we get beyond these silos?
That's a big question.
Well, you guys have that to some extent, so.
I definitely have, just in my own professional career, kind of struggled with this of like both wanting to be grounded in kind of the softer qualitative skills, as well as wanting to be able to do the simulation and the math, and it's hard to do all of it. I think the more and more we can create teams where we have from across these different disciplines, and we can work together and learn what our strengths and weaknesses are, I think that's great. I also think, like starting with youth and sort of in our education system itself and bringing systems thinking to them and sort of building that pipeline up, it could be really important here.
Dr. Kasman, what are your thoughts?
Yeah, I think one of the really nice things about both education and public health is these are areas where the traditional boundaries between quantitative and qualitative work are falling apart. And I think in a good way, where people are increasingly understanding that it's important to use qualitative findings to build up a sense of external validity, an intuition about how causal mechanisms are actually operating, and how quantitative methods can help identify things like tipping points and timescales. So this is really nice to be in a time and place where people are starting to work together, are starting to drop kind of the pre-existing defensiveness and prejudice that they've had for the sorts of work that other people are doing, and to sort of focus in on, okay, what can I do in this specific research context to make the world a better place?
Okay, thank you. We have two more thought-provoking questions, and they're both for both of you. Do you think meaningful virtual fitness program to encourage activities and movement, regardless of location, social or cultural background, is an effective way to help the most vulnerable people?
So this is interesting in that, I'm kind of, there's a second question that's sort of similar following this around social distancing and how that could impact health. And it's something that with my group has definitely played a role and has been difficult, challenging. Some of what we learned from the youth through all of this work was how important those social connections were to being healthy and active. And so we've done a lot of questioning with the youth virtually now of what this might look like for them, how they could, maintain active, healthy lifestyles, but doing it in sort of safer ways. And I don't necessarily have any grand answers or solutions, but I think it's something that we're going to definitely be grappling with for many months to come.
Dr. Kasman?
Yeah, I think in this, like in a lot of other things right now, we need to be cognizant of negative unintended consequences that may exacerbating existing disparities. And by that, I mean, there's emerging evidence over the past couple of months. It really is that fresh because this is a new world we're living in right now. That it's great that there are remote school options. The problem is access to them and ability to engage with them in an uninterrupted, productive way is not evenly distributed among the population. And there's some evidence coming out, again, this is really recent, past few weeks, past month, that we're seeing essentially a rich get richer story. Where students who are affluent, middle class, come from privileged backgrounds, are keeping up with their schoolwork, or coming into the summer having completed, on grade, and other students, unfortunately, are falling far behind. And so the question is, how can we make these resources more equitable, such as this doesn't happen? It doesn't happen in other realms, such as physical activity, for example.
So do you think, going back to that disparity issue, do you think it's a question of the social structure, the social context in which these students find themselves, a lack of access to technology, a combination of factors? I'm interested in your thoughts upon that.
So I'm certainly not an expert on this, and I've only seen limited evidence and data, but it seems quite likely that it is a confluence of factors, some of which are synergistic, unfortunately. Some of it is social, the support that they receive, the ability to work in a quiet, uninterrupted setting. For example, some of it is around place of residence. Is it noisy? Is it comfortable? Is there decent Wi-Fi? May come into play. Something that I wouldn't have thought about 5 years ago necessarily. Some of it is about technology. Do people have working technology, up-to-date software, knowledge of how to use it, someone that they can turn to in their familial setting who can help them when they don't have these things, or when they don't work. I forgot to take myself off mute, and I had someone very competent able to remind me, Matt, take yourself off mute. Not everyone has that at home when they're engaged in remote learning. So it's the sort of thing, I think there really is quite a bit that comes into play. And there's probably other factors I'm leaving out, from nutrition to living in a place that's, where you have clean air and light. Probably makes a difference.
Thank you. Dr. Freewicks, do you want to comment or expand upon that? We have about 1 minute left.
Yeah, I think I would just definitely agree that there's definitely a confluence of many factors. And that's the beauty of systems thinking in science, is it can really help us understand all of those interconnections and all of those factors together. And I guess the one thing kind of go back to is to always really think about, and actually has come up a lot in my work, is really approaching more from an asset-based approach, and really thinking about not what are the problems, but what are the assets, and how are communities and individuals resilient, and how can we build on that with our research.
Okay, thank you. I want to thank the audience for your thoughtful questions, and of course, a big thank you to our wonderful speakers for their presentations, which were terrific, and also their thoughtful remarks to the questions that I raised and that the audience raised.